Okay, so I'm going to go ahead and start. Greetings, my name is Kathleen Steele, and I will be moderating today's session. I'd like to start today's webinar out with a quote. Our quote is going to be from Brené Brown. Faith is a place of mystery, where we can find the courage to believe what we cannot see, and the strength to let go of the fear of uncertainty. Last webinar, we discussed reversing Alzheimer's and memory loss using the RECODE protocol. You can learn more about it by checking out our YouTube channel, which you can find through going to www.theholistichealing.org and selecting the YouTube icon. And you can also find us on Instagram and Facebook. Please go ahead and subscribe to our YouTube channel for updates and for any upcoming future webinars. I'd like to thank you for being part of our wellness community. And we realize that despite your busy schedule, you have opted to join us and participate in this webinar to help yourself, your family, and your community live healthier lives. Today, we ask that you please remain on mute and you type all of your questions in the question and answer section down below, rather than the chat box. That way we can make sure we answer them all and check them off as we go. So today we're going to discuss freedom from autoimmunity. So Dr. Nadia Ali, that's who I will be interviewing. She is the founder of functional integrative medicine practice, Functional Holistic Healing. She's been practicing for 18 years, board certified in internal medicine specialty, board certified in integrative holistic medicine, board certified in the American Board of Integrative Medicine, a fellow of the American College of Physicians, a member of the Institute of Functional Medicine, and she has certifications in the areas of nutrition, mind-body, Ayurveda, and Chinese medicine. You can learn more about the practice at www.theholistichealing.org.
Thank you so much, Kat. Really appreciate that. So what I want to do is I want to start by introducing Beth, who's with us today. I will talk a little bit more about her, and then she will tell us her story. But I consider Beth a superwoman, and my definition of superwoman is not somebody, who has everything that she wants. I think my definition of superwoman is a woman who actually faces a lot of challenges, but is able to overcome them because she has strength of character. And I think if you listen to her story, you will find that. So she lives with her husband and younger son, who's age 23, 2 dogs, and a pet snake. So here is what her role is. So she is a mom, first of all, a very proud mom. Both her sons are college graduates and gainfully employed. She is also a caregiver. So she has an 80-year-old mom who lives independently, and Beth actually helps her out in whatever ways she can. And now we go on to her career. And so she actually works as West Whiteland Township CFO. That this is a position she's held for over a year. She's a founder of Colostrum Charter School and she actually served as its CEO for like 15 years. And prior to that, she served on its board of trustees. She's a secretary for the board of Pennsylvania Coalition of Public Charter Schools. So even if you look at her career, she has done extremely well. So she juggles a lot of things. And she enjoys swimming. She's achieved her goal of swimming 1 mile 3 times a week during her workout. She enjoys Flyers hockey, taking walks with her husband and dog, and traveling to warm places. So one of the things that you see here is that she has been great at whatever she has done. And it's not because she hasn't had challenges, it's that she has faced them. And one of the challenges that she came to me with was her rheumatoid arthritis. And I'm very honored that I'm part of her healing journey, because this journey was not an easy journey. And yet the way she took that challenge and the way she ran with it is probably the reason why she succeeded. And that is why I think her story is inspirational for all of us who have our own challenges. So with that, I'm going to go ahead and have Beth tell us her story. so that we can all learn something from it.
Thank you, Dr. Ali, for your kind words and your generous introduction. Folks, as I present my story today, I'm going to do so linearly so that you can see the antecedents to my diagnosis, as well as have a realistic presentation of the length of time that it may take to get properly diagnosed and treated. And you'll see throughout my slides that I use the metric of weight, or my BMI, to mark progress. I chose weight because it's common, it's universal to everyone. And while I may be more pleased with my reduced CRP rate or my reduced cholesterol and glucose, those numbers might not apply to everyone, but healthy eating and maintaining a healthy weight does. During much of the pre-diagnosis time, as you can see on the screen, there were a good number of stressors in my life, from my dad's diagnosis with lung cancer to some surgeries, a job that I loved just becoming unbearable. And then, after my father passed away, the symptoms of my RA really just started to run rampant with awful pain, exhaustion, brain fatigue, which is that's just one of the most confusing ones, because you automatically think the worst, like, oh, do I have a brain tumor? Do I have Alzheimer's? What's happening here? When somebody who is usually sharp and remembers details, when you start to forget things. It's a time of a lot of doctor visits, a lot of testing. I saw so many different kinds of health professionals: primary care doctor, endocrinologist, gynecologist, gastroenterologist, a surgeon, an orthopedic surgeon, and a nutritionist. And while there were some RA symptoms throughout all of this pre-diagnosis period, lab results just didn't support what I was feeling and experiencing and reporting to traditional doctors. So it took quite a while to get a correct diagnosis, and it was frustrating. And unfortunately, traditional doctors are not trained to respond holistically, and the current medical system doesn't support them, even if they were trained and wanted to do so. I thought it was important to share that, throughout the stressors, we had a 3-month waiting period before I could see the rheumatologist. And during that time, my symptoms worsened, my weight gain continued. My husband and I were very worried, and it led to real stressors in our marriage. I think the worst stressors we had in our 20-year marriage. So we did see a marriage counselor for a period of time during that summer. But once I got the diagnosis and we knew what was going on, and we knew that there was some treatment, it was almost immediate, where we started working together as partners again and as a team, instead of me being miserable and upset all the time. So with my original diagnosis, I was seeing a traditional rheumatologist, and I began treatment with a drug called methotrexate. You could see my weight there. It was just way out of control. But there was also relief that I knew what was causing all of my symptoms. And also that there's a frustration and a worry, because now I know that I have a chronic disease, and I'm going to have to be aware of this and dealing with this for the rest of my life. I was fortunate in that methotrexate is a relatively reasonably priced drug, and that it did begin to work for me, but it also came with side effects that were often worse than the symptoms of my rheumatoid arthritis. Our family has long turned to alternatives to traditional medicine with success. And we found that doctors like Dr. Ali and doctors who practice in similar ways really listen to patient comments and incorporate those comments into the treatment plan. It's a partnership of treatment. It's not just a lab coat and a prescription pad. But even with all of like 2 decades of success of working with non-traditional doctors, when I first started working with Dr. Ali, I was definitely a little skeptical. I really thought that nothing was going to work, because I had been seeking an answer to my symptoms for years, and nothing had worked before Dr. Ali's treatment did. And I have my husband to thank for that. I mean, he was the one who just was so fed up with the side effects and so concerned about the toxicity of the pharmaceutical drug that I was prescribed. He started researching alternative treatments, and that's how we found our way to Dr. Ali and piles of blood work and other testing. And that's when the treatment that I think really started to work kicked in. It was really the comprehensive approach to figuring out what was going on inside my body that was causing the rheumatoid arthritis symptoms. And, you know, pretty quickly after starting a food plan and starting a supplement program that allowed me to also start exercising because I felt better. You know, my symptoms started to decrease, my weight loss began, but unfortunately, pretty significant methotrexate side effects came back. And, you know, we switched to a different type of methotrexate. Side effects went away at first, but then came back again. And the rheumatologist really wanted me to try an injectable biologic. And I was scared of that. I didn't want to do that. My husband didn't want me to do it. I tried really hard to get that then rheumatologist to consult with Dr. Ali regarding LDN, which is a pharmaceutical, but it is not often prescribed for rheumatoid arthritis. That rheumatologist was very skeptical about it. She did not reach out to Dr. Ali like I asked her to, but I started it anyway. And then that rheumatologist just decided she was leaving her practice. And so I was left with the task of trying to find a new rheumatologist, which actually it worked out for the best because that rheumatologist is very much aware of complementary treatments, alternative treatments, and she's definitely okay with me working with Dr. Ali and her to find the best path forward. And she removed methotrexate from my care plan because my blood results were good and that my side effects were just getting worse without any real reason. You know, this fall I had a little bit of a setback because I had to have surgery on my left knee for a torn meniscus. And, you know, since I had the right knee meniscus surgery 4 years ago, I knew what recovery would be like, but recovery with RA was definitely a little bit longer. So I had to have patience, which is not always my thing. But you know, I'm in a pretty good place right now with that knee. And, you know, as the winter continued into 2021, you know, my symptoms continued to ease. And, you know, I've now been able to achieve an exercise goal of swimming a mile about 3 times a week. And it can be really difficult to make the changes that are necessary for treatment to work. You have to be motivated and determined. You have to have knowledge about yourself and be willing to admit things that are awfully, sometimes embarrassing. And that coupled with Dr. Ali's knowledge, plus the support of an ally in this process, that's what's going to lead to positive results. And then those positive results positively reinforce the new behaviors that you're doing that are making the treatment work. And so while everybody's everybody's treatment plan is going to be varied based on whatever your illness is and what your needs are, there is one thing that's pretty consistent. I mean, you need to follow Dr. Ali's instructions and ask a lot of questions. You will learn a lot about yourself and about your ailment, about your body, and how to help it help itself. You know, I think as one positive that came out of the pandemic is that I know that it would have been a lot more difficult to start and follow the food plan during normal times because, you know, I'm not eating bread, I'm not eating meat, I'm not eating dairy products, and that's not socially normal in the United States. So working from home the majority of time and not having social obligations have really made it easier to make drastic changes to the food I eat. And, you know, my ally in this has been my supportive spouse, Nate. Without his help, I'm not sure I could have done this by myself. It's challenging. It takes a lot of determination, like I said, but it's super important to have somebody who can be your ally throughout, holding your hand, being understanding and supportive, reinforcing you, and being a good listener. And there's some takeaways on this final slide that I have. Dr. Ali, if you want to click ahead. Oh, there you go. They're there. I'm sorry, they're there. I was looking at the wrong screen. But these are some of the things that I've learned, and I try to remind myself of, especially when things maybe get a little tough. If I'm having a rough day with, you know, following the food plan, if I don't want to exercise, I really try to remember that final takeaway about keeping a positive frame of mind and taking things bit by bit, and recognize that have to stay positive, have to stay persistent and determined. And hopefully, hearing the path from pre-diagnosis to successful treatment that I've had, hopefully, there's something about that can be helpful to you. That's why when Dr. Ali asked me, that's why I said yes to coming and helping here, because I know it would have helped me if I had heard somebody who was at this part of the process speak about the process when I was at the beginning of it. So thank you for allowing me to share my story with you.
Thank you so much, Beth. I think that was really actually helpful, because I think that the few things that you said, especially about the motivation and consistency, and that the path is challenging. I think that's really the key. That nothing is going to be easy, especially if you are planning to not band-aid the situation. Then, if you want to have the right path to really remove the cause, then it will be a challenge, because clearly this challenge hasn't come today. This challenge has come in from some time. And so, of course, it will take you some time to get out of it. So it's a process. And I think that, anybody can actually succeed, provided they actually are consistent and motivated and stick to the process. So thank you so much for sharing this story.
Thank you so much, Beth. I feel like stories always kind of take it home and make it more personal. I know they always help me understand and kind of put myself so I can understand better. So, Dr. Ali, what exactly is an autoimmune disease?
So before we try to understand what an autoimmune disease is, we should understand what an immune system is. What is it made up of? And the immune system is a defense system. And the cell that is responsible for protecting us are the defense cells, which are the white cells, the lymphocytes. And these lymphocytes actually travel in these lymphatic vessels, which are present throughout the body, including the brain. And these cells actually have stations where they come together and they get messages, and then they work according to the messages. So you can call them actually police stations. So these are our police stations, tonsils. And a lot of times we think, oh, tonsils are just worthless and we can just remove them. No, tonsils are actually made up of the lymphocytes, which are the defense cells, lymph nodes, spleen, thymus, appendix, and bone marrow. However, the one part that's not mentioned here is the gut. 70% of our immune system actually resides in our gut. And that plays a very important role in the defense of our body against bacteria, viruses, fungi, so on and so forth. Now, remember that the goal of the immune system is to protect us from something that's entering from outside. So if a bacteria is coming from outside, a virus is coming from outside, we talk about COVID-19 attacking us, and then this immune system of ours responds to it by producing antibodies against the virus, against the bacteria. But imagine if this immune system is disbalanced, and then instead of just killing the virus, it starts killing our own cells and our own organs. When it does that, then we say that this is an autoimmune disease. Because what has really happened is that the immune system is confused and now is intolerant of our own cells. So you can have a target for the autoimmunity anywhere in the body. So you can have antibodies against brain or thyroid or lungs. And so it can affect any organ. And depending on the organ that it attacks, we often classify the autoimmune disease. For example, if it is thyroid that's attacked, then we say it's Hashimoto'S or Graves'. If it hits the bones and joints, then it's rheumatoid arthritis, ankylosing spondylitis. If it affects the muscles, we say, oh, it's muscular dystrophy. If it affects the skin, then it could be psoriasis, vitiligo, eczema, scleroderma. If it affects the lungs, it's Wagner's. If it affects the GI tract, it could be celiac disease, it could be inflammatory bowel disease, it could be diabetes type 1. If it affects the blood, it could be lupus. If it affects the brain, it's multiple sclerosis and Guillain-Barré. So basically, we now know that almost any organ can be attacked by our own immune system if it gets imbalanced. We now know that there has been a dramatic increase in these diseases since 1939, and we have over 100 different types of autoimmune diseases that we now know of. Unfortunately, they are growing in prevalence, and we have up to 10% of US population with autoimmune diseases, with almost 24 million people affected. This is the reason why we are here talking about autoimmune diseases, because it is important to understand what they are, why they are there, and what can be done about it.
So what are some of the consequences of autoimmune diseases?
So obviously, the short-term consequence is that organ against which the antibodies are directed is going to get destroyed and will not function. But there are other consequences. For example, 1 in 4 individuals with one autoimmune disease will develop an additional autoimmune disease. And the reason is very simple. If you are not blocking or reversing the reason why your immune system is activated, it will continue to remain activated. It will continue to churn antibodies against other organs. There is actually an entity called multiple autoimmune syndrome, where we find that there are 3 different autoimmune diseases in the same patient. Sometimes it could be more. And that's called multiple autoimmune syndrome. And the reason is the same, an imbalanced immune system. We also know that autoimmune diseases increase the risk of heart disease. They increase the risk of stroke. They increase the risk of cancer. Clearly, all of those 3 conditions, heart disease, stroke, and cancer, are increased when there is underlying inflammation, which is a cornerstone of autoimmune diseases. We also know that they reduce the life expectancy of individuals. And now we know that it's the leading cause of death in every age category of women under the age of 65 years. And we know it's the case in women because women are much more at risk of developing autoimmune diseases as opposed to men. And we'll talk a little bit about why that's the case, but clearly it's something which is affecting our life expectancy.
So what is the conventional approach to autoimmune diseases?
So in the conventional setting, basically the idea is we use a protocol-based approach. So there's a first line of medications that you start with, then there's a second line, then there's a third line, and there's a fourth line, so on and so forth. So irrespective of, what your background is, what your exposure is, everybody will be treated according to the protocol, okay? And so in the conventional approach, we know that there is no cure for autoimmune diseases, and it's about managing symptoms, okay? So what do we use for symptom management? So symptom management is simply putting a Band-Aid. Now the problem is that in this case of autoimmune diseases, this Band-Aid is not some nice fresh Band-Aid. It's a dirty Band-Aid that we are putting on it. And as you can see in Beth's story, that the treatment was becoming more problematic than the disease itself. So the first line of medications that are used are called Nsaids, which are non-steroidal anti-inflammatory drugs such as Motrin, Advil, Naproxen. Now these drugs, even though they're available over the counter, have a ton of side effects. They can cause stomach ulcers, they can increase the risk of heart attack and stroke, they can cause kidney failure. If that level, if that Nsaids does not help the situation, then we often move to steroids. Steroids is the second line, which has a ton of side effects, which is the reason why they're not recommended to be taken on a long-term basis. They can increase the risk of infections. They cause osteoporosis, diabetes, high blood pressure, significant mood abnormalities, cataract, glaucoma, so on and so forth. So they may put you on steroid, but they would not want to put you on it for a long time. So what would they do? Then they would switch to what is called steroid sparing options. So what are the steroid sparing options? So the third line here is what we call disease modifying anti-rheumatic drugs. Examples of these are methotrexate, which Beth was on. Now we have some research which shows that these drugs slow the disease progression, but they come at a big cost. And as Beth was saying, that her side effects, were killing her. And so these drugs, in addition to kind of causing clinical side effects, they also cause liver damage. They cause suppression of the bone marrow. They cause severe lung infections. Let's suppose if these do not work, then the next step is the big guns. So what are the big guns? The big guns are what we call the biologics. Examples of that would be Humira, Enbrel, Remicade. And when you are on these big guns, the idea or the concept is your immune system is completely suppressed. We do not want any movement of the immune system at all. Now, when you're able to do that, you will see that the symptoms will reduce because immune system is now not able to do anything, not even make a small tiny noise. But remember that we need the immune system because that's a first line of defense against infection. So if you suppress the immune system so much, what are you going to get? You're going to get severe infections, serious in nature, life-threatening in nature. We also see that those who are on biologics have reactivation of hepatitis B and tuberculosis. There are significant central nervous system symptoms like vision problems, sudden vision problems, tingling, numbness. There could be heart-related reactions, such as sudden heart failure, shortness of breath. And interestingly, the biologics that we use to treat autoimmune diseases can actually cause autoimmune type of reaction, like lupus, with a rash, joint pains, body pains. So clearly, we see here that this approach is a very, very risky approach. For short term, yes, if you are at a point where you cannot function, you want to be on it for short term, you can try that. But if you are looking at it from a long-term perspective, then clearly this solution is creating bigger problems.
So what is the functional approach to autoimmune diseases?
So I wish we could have a medication like that, which would treat the side effects as well, but we don't. So the functional approach basically is about trying to find the cause. Why is this happening? Because if you don't know why it's happening, it doesn't matter whether you treat with a big pill or a big supplement. It's just still a Band-Aid. You can say, well, this Band-Aid is cleaner. Okay, but it's a Band-Aid. You still don't know why this is happening. And there are only so many Band-Aids you can put before you will have another wound, and then you'll put another Band-Aid. So then you'll be covered with Band-Aids, still not knowing where you're going. So the first question we have to ask is, why do we have autoimmune disease? What is the basis of it? Is the body crazy? No, the body is one of the most sophisticated systems. Why would it suddenly start kind of kicking itself and, killing itself? So I want you to understand the concept of molecular mimicry. This is one of the theories by which we explain autoimmune diseases. And according to this concept, you can see this background. If you look at a background and if you don't look at it carefully, you may think all of this is one piece, but it's not. So basically, the concept of molecular mimicry says that what happens is the body, when it produces antibodies, they were directed against virus or bacteria or fungus or toxin. But what happened was the bacterial protein or the viral protein or the toxic protein that came inside the body resembled another protein on one of our organs. And so the antibody started to hit the actual target, but suddenly it sees another target inside the body. And now it's confused as to, oh, well, this target looks just like the one we just hit. So maybe this is an enemy too. And so then they are also directed towards the target inside the body because there is resemblance. So that is one of the theories of autoimmune diseases. So basically, if you look at what happens on the larger picture, on the bigger picture, what happens is that there is this entity called intestinal permeability or leaky gut. So when you have that, you have undigested protein that come in. There are toxins that are coming in. They are bad bacteria or fungus or viruses or parasites or stress, which causes the gut barrier to break down. And so you have a lot of foreign stuff that enters the body. And when it does, it actually causes production of inflammation, but it also activates the immune system that starts producing antibodies against these. And then if that antibody finds any resemblance between what's coming in through the gut and what is coming in, what is inside already present, then they could be directed against that. Now, this leaky gut is actually a vicious circle because if you see, once bacteria release toxins like LPS, which produce inflammation, that process of inflammation also causes release of certain other chemical compounds, which then further increase the leaky gut. So clearly the patient is in this vicious circle. And if you remember, Elizabeth's story is really amazing because she kept on saying that she had the symptoms that started, and then the weight continues to go up, continues to go up, continues to go up, because she was actually in a vicious circle where this vicious circle was going on and on and on and wasn't stopping. So even though, she was doing everything, at least in her power, she couldn't figure out why this weight just went on and on and on without stopping. Now, I'm not going to go into a lot of depth of leaky gut because we have a webinar on it that you can go ahead and watch.
I went ahead and posted the link to the YouTube, so you can go ahead and get the webinar on leaky gut and watch it at your leisure. So the next few questions I'm going to be asking are going to be basically about what things like what roles things play in autoimmune diseases. So for instance, what is the role of genes in autoimmune diseases?
So, a lot of times when people have an autoimmune disease, they will relate back to either their mother or their cousin who have an autoimmune disease, which is either similar or different, but it's still autoimmune in nature. But fortunately, we cannot blame our parents for these diseases. So yes, you may have a gene, but that gene is dormant, which means that, it is not currently active. So the contribution of the gene is about 30%. But when you activate it, and how do you activate it? You activate it through the environment. When you activate it, which is 70% of the role, when the combination of gene and environment happens, that is when you get what is called the leaky gut, which then leads to immune activation, inflammation, and oxidative stress. Oxidative stress is basically the release of free radicals, which go on to destroy the organs in the body. And so that combination then leads to what is called autoimmune diseases.
So what is the role of the environment in autoimmune diseases?
So the environment has an enormous role. And when we say that the autoimmune diseases have been increasing since 1939. Clearly, our genes have not changed since 1939. What has changed is the environment in which we are living. So we know that there are a lot of factors in the environment which play a role: smoking, obesity, dental infections, bacterial and fungal infections, mold toxins, estrogen. So remember, we said that women are more predisposed. Why? Because if you have a lot more estrogen than what you can handle, you are going to get into trouble. Pollution, environmental toxins, medications, lack of sleep, stress, and food are all the factors which can mediate autoimmunity.
So what is the role of smoking then in autoimmune diseases?
So smoking is the most well-researched variable. We know that it is implicated to be a risk factor for rheumatoid arthritis, multiple sclerosis, lupus, and Graves' disease. And when I say smoking, I don't mean just active smoking. It includes passive smoking as well. The way smoking causes problems is that it directly can cause inflammation, because you know that a lot of the chemicals in the smoking are actually cancer causing, but they also directly cause inflammation. And the second pathway is that it causes reduction in oxygen, which is what we call hypoxia. And hypoxia itself can also cause inflammation. And in people who have rheumatoid arthritis, their antibodies actually can be produced as a result of this chronic inflammation from smoking.
So what are the roles of dental infections in autoimmune diseases?
So this is something which is often overlooked. I have people in my office, and they would never even mention it, even if it's on the list of things that they check off, because it's not ever in their mind that this could be a factor. And this is a huge factor. When I say huge factor, I mean a huge factor. We have a lot of data. So if you see here, this is gingivitis. This is like, your gums are inflamed, So when you brush, there's going to be bleeding, or when you wake up, you feel rawness of your mouth. Or, they would tell you that, I have a bad breath. And or the partner tells the patient that, look, you have a bad breath, but they don't think it's a big deal, but it is a huge deal. So from gingivitis, you can go on to periodontitis, which is basically now, in addition to the gingiva, you are actually, inflammation is extending into the ligament around the teeth and also the bone with which the tooth is attached. When you get into that situation, what really happens is that you make a biofilm because of the inflammation. And in that biofilm survive bacteria and fungus. And these bacteria and fungus actually get inside your bloodstream every time you eat, every time you bleed, every time you brush your teeth. And these bacteria cause chronic inflammation, long-term inflammation. The body is constantly fighting, constantly fighting. And we also find that in these individuals, they have high levels of inflammatory markers like C-reactive protein, interleukin-1, interleukin-6. We know that many autoimmune diseases are directly linked with periodontitis, gingivitis. In rheumatoid arthritis, there is a particular bacteria identified, which is P. gingivalis, as a trigger. But remember, it's a trigger in a subset of patients. Not everybody with RA will have this problem. So you really have to know everybody as an individual. In ankylosing spondylitis, we also know that individuals who have periodontitis have twice the risk of developing ankylosing spondylitis. We also know, and this is really, really scary, in psoriatic arthritis, we found that these bacteria in the mouth, their DNA was present in the joint fluid. The P. gingivalis and prevotella were found inside the joint. So it's really interesting that how much of an impact does the mouth have. In lupus patients, one of the really interesting things they found was that the disease activity in these patients actually got better when they treated their periodontal infections. And it's a direct indicator of the role of the inflammation produced in the mouth.
So what about other bacterial and fungal infections? What roles do they play in autoimmune diseases?
So we have a number of autoimmune diseases which are linked with specific bacteria, but remember, it's not going to be in all cases. Like Klebsiella has been implicated in ankylosing spondylitis, and rheumatic fever and streptococcus is an old relationship. We already know about that. And Proteus has been linked to rheumatoid arthritis. We now know that these bacteria actually release something called LPS. LPS stands for lipopolysaccharide. It's a toxin. And, when you produce that toxin, when the bacteria produces that toxin and that gets into the bloodstream, that plays a very important role because that is what induces inflammation and immune activation. There are a lot of other intestinal bacteria that we know have been implicated, like Salmonella, Shigella, Campylobacter, Yersinia, and Proteus. So that's number one. Number two, as far as fungus is concerned, mold toxins, a very important cause which is often overlooked. And I cannot tell you how many people we have found mold to be a problem. And they are not aware that it's a problem, which is very interesting. And if you look at the study in 2003 that I mentioned here, it's mind-blowing. The 209 individuals in water-damaged buildings. Remember, that's the primary cause of mold is where you live, what you're exposed to. These individuals were found to have increased levels of anti-nuclear antibodies, anti-smooth muscle antibodies, antibodies to neurofilament, and antibodies to the myelin of the peripheral and central nervous system. So it was very clear that these individuals, even if they're not diagnosed, they are in the process of getting to the point of having issues of autoimmunity. Here is another study which looked at the ingestion. So this is like, when you eat or when you ingest ochratoxin or DON. Ochratoxin is a mold toxin. So the way mold functions is through mycotoxins or mold toxins. And when they ingested that, they found that they actually developed RA, rheumatoid arthritis, or the severity of the disease actually increased. We also know that there is a Finnish study which looked at a number of individuals who were exposed to water-damaged buildings. And these individuals have very high risk of developing thyroiditis and Sjogren's disease. So we have very clear-cut evidence that these things can cause problems, and they often go unidentified, actually.
So do non-living environmental toxins ever play a role in autoimmune?
Definitely. So if we look at, I'm going to start off with traffic exhaust. And we often talk about global warming and pollution, and then there is a debate, it's just the environment, we can probably deal with it. The truth is that, the pollution and the exhaust is not just killing the environment. It's killing us. It's killing our kids. And if you see here, we have data which shows that when you have traffic exhaust, which is about 2.5 p.m., it has direct consequence in production of antibodies in lupus, like anti-double strand antibodies. These patients were found to have renal casts. So we know that there is a direct consequence. In RA, again, we found that 2.5 p.m. particulate matter increased risk of developing RA. It is implicated in multiple sclerosis. It's implicated in diabetes type 1 and juvenile idiopathic arthritis. And so it's very important, something that we don't think about is the amount of environmental exposure to exhaust, to pollution, but we are the ones who bear consequences of it. And then, of course, this in addition to some other toxins that we will talk about. So this is the mechanism of how the toxic, the traffic exhaust causes problem. It can directly cause inflammation. It can cause production of free radicals, which can destroy our organs, and it can directly activate the immune system. So there are many pathways through which traffic exhaust can cause autoimmune disease. And this, in addition to all the other things that we consume, lipstick, nail polish, we are sending our clothes for dry cleaning, we have mercury in the fish, toothpaste, perfume, deodorants, cleaners, we are surrounded by toxins. So it is not a surprise that we see an increase in prevalence of these diseases, because clearly the amount of toxin exposure has significantly increased.
So what about medications? Can medications cause autoimmune diseases?
Definitely. Unfortunately, a lot of these medications are used very commonly. Blood pressure medications like lisinopril, hydrochlorothiazide, cholesterol medications, statins, epilepsy medications, antibiotics, which are commonly used to treat infections like urinary tract infections, ciprofloxacin, nitrofurantoin have been implicated. Now, these are the medications that we get over the counter. Motrin, implicated in autoimmune disease. Antidepressants implicated. Biologics, we already talked about that. Oral contraceptives, because they contain estrogen, and we already talked about the role of estrogen. So clearly, medications are a problem, and we have actually diagnosed in our practice people who had autoimmune disease as a result of the medications they were taking, which was very interesting. And in one case, the medication was being taken to treat autoimmune disease. And then, so it was one autoimmune disease that was being treated, and the woman was developing another autoimmune disease, which was being termed as lupus. And we actually found there's actually an antibody that you can check, which is called antihistone antibody, which indicates if it's a drug-induced lupus. And she had antihistone antibodies. There was a second case where a young girl was found to have autoimmune disease as a result of the antibiotics she received for treatment of urinary tract infection, because she was being treated again and again and again. And I had to stop the charade because it was not an infection, it was just a colonization. But every time they would find that bacteria in the urine, they would want to treat that poor girl, and then she would have a flare up of the autoimmune disease. So, the problem is also the system, in which we are, where we are so much used to band-aiding. And that now even parents want to band-aid. So they would call and say, my child has X, Y, and Z, or I have urinary tract infection, can you give me an antibiotic? Without having any regard for what will be the consequences.
And a lot of times we're taking these medications for stress purposes to keep our stress under control, because we hear how scary stress is. So can stress cause autoimmune diseases?
Absolutely. Stress is a biggie. Stress actually, it can be something as a result of trauma, and trauma is often, goes unnoticed. People often don't talk about what they have, witnessed in their life, what they've experienced in their life. Bad relationships. Beth was talking about, the job stress that she really loved. And a lot of times, by the time we leave the relationship or we leave the job situation, it's already when we are at a breaking point, because we don't listen to our body. So we keep doing till we are at our wit's end. But does it have to be that way is the question. It doesn't have to be that way. So stress actually causes the adrenal glands to release cortisol, which is a hormone of inflammation. And then cortisol can cause leaky gut. Cortisol can change the bacteria in our gut. So that is how stress has a role in causing autoimmune disease.
So I know when I'm stressed, a lot of times I reach for food. So how does diet impact autoimmune disease?
So that's a great point. So actually stress works through, when you are stressed, obviously you make the wrong choices. But not only that, when you are stressed, you don't even sleep because you can't sleep, because you're stressed out. And we know that lack of sleep is very important in causing autoimmune diseases, because sleep is when you heal. Sleep is when you detox. So so stress comes with two additional, like, issues, which is the diet. And of course, we know that processed diet is highly inflammatory in nature. And that is why it can induce inflammation, it can induce leaky gut, it can change the gut bacteria, and definitely is a contributor. And as Beth was saying, that, like, sometimes we think what we're doing is healthy, but is it? Is that what your body wants? So definitely a huge factor.
And a lot of times obesity gets blamed on eating highly processed diet solely, or, not exercising. So I wanted to ask kind of what is the role of obesity in autoimmunity?
So it's very interesting. You mentioned that processed diet, its connection with obesity, but obesity has connections in addition to processed diet with stress. Obesity has connections with inadequate sleep. We know that people who don't sleep often gain weight. Obesity has connections with exposure to toxins. Obesity has connections with exposure to infection. Obesity has connections to environmental exposures to, for example, the exhaust that we talked about, the traffic exhaust. So when somebody is obese, it is not necessarily just about what they're eating or whether they're exercising or not. It's basically a body signal for inflammation. So as Beth said, that, people feel ashamed. I would ask you not to feel ashamed, which is what she said. Because it is not just about what you eat and whether you exercise. There are a lot of variables involved. And as opposed to the notion that, that fat is dormant tissue, fat is not a dormant tissue. It's a very active tissue. It releases adipokines, which are inflammatory compounds, which actually break down the body's self-tolerance because they are pro-inflammatory in nature. And we know the number of diseases that have been linked to obesity: rheumatoid arthritis, lupus, inflammatory bowel disease, multiple sclerosis, type 1 diabetes, psoriasis, and Hashimoto'S. So, and of course, other thyroid autoimmune diseases as well. So clearly a huge factor, so this is a study in which they looked at women under the age of 55 who were obese. And they found that these women were 37% more likely to have rheumatoid arthritis. And unfortunately, the earlier in life that you start becoming obese, the higher is your likelihood of developing rheumatoid arthritis. So a huge factor, huge indicator.
So can we prevent autoimmune diseases?
So that's actually $1 million question. And the answer is, thankfully, yes. So what we now know is that we produce antibodies many, many, many years prior to the clinical outcome of what we see. And if you look at this second slide, you can see that there's about 13.8 years prior to the clinical appearance of the disease that you find rheumatoid arthritis antibodies. In lupus, you have 8.1 years where you can do the prevention. For MS, you have 3 years. For autoimmune thyroid disease, we have 7 years. So for inflammatory bowel disease, 4.5 years. I mean, so we have been given that opportunity where we can intervene. And it's very interesting that a lot of times we are given signals. We have aches, pains, headache, okay, like, yeah, whatever, it's just a headache. I can always take a Motrin and do what I need to do. But that's your body's signal. As you keep on ignoring signal after signal after signal, antibody production is going on. And then at one point, when all hell is going to break loose and you can't do anything, that's when we stop and say, okay, let's figure this one out. What's going on? But that's when it's late, because you really haven't paid any attention.
So I know that, I'm not sure, we had talked about before that, there's a protocol in conventional medicine. And in functional medicine, there's not necessarily a protocol. So what exactly is the functional process of addressing autoimmune diseases?
So, this has been talked about, RA, and in a functional approach, what we do is we look at each person as a puzzle. Okay, so Every puzzle is different, just like every individual is different. And you have to look at what are the points, like, what are the, clues in each case. And then you have to listen to the patient. That's the key. If you listen, then you will understand all the layers to that picture, all the nuances. And once you know that, then you have to start with food. Everything starts with food, and the second thing is tests. So if you look at a history and you say, oh, I think this is what is the problem, you are not supposed to act then. You're supposed to first verify what you are thinking is a hypothesis. And the tests help you to confirm it. And once you're able to confirm it, then you have objective data. So instead of just hypothetically moving forward or doing, a lot of people say they're doing muscle testing. There was a time muscle testing was used because we did not have better tools. Now we have much better tools. We can use those to identify the problem. Stress has to be addressed. A lot of times we look outside for our issues, but the issue is inside. If this is not cleaned, whatever is outside, it's not going to make a difference, And so looking within, understanding our traumas, understanding our coping strategies is extremely important. I cannot emphasize the role of mind enough, and how many times I, as a functional physician, have been beaten. And I've been confused, and I'm like, I don't understand this. Why is it happening? And then later on, I'm like, oh, that was it. And so that is why mind is 99% sometimes responsible for the situation, and you have to remove it. And mind is also when it comes to when you're doing the approach, like when Beth came to me and I'm telling her to change all of that. What is your mindset? How do you look at it? It's very important. It will also play a role in whether you will succeed or not. Your mindset makes a huge difference to how you view what you're doing. Of course, we have to address leaky gut. No question about it that it has to be addressed. What is the cause? How do we heal it? And of course, toxins have to be addressed because they play a major role. And again, we have a webinar on toxins that you guys can go ahead and take a look at. It was on mercury, but it gives you an idea of what does the process of detox look like. But that is what you have to do. There are lots of tools that we use in functional medicine. There are botanicals, there are herbals, there is infrared hypothermic therapy, there is fasting, mind-body techniques, but everything is not for everybody. Everybody will have their own story, they will have their own journey, they will have tools which will work for them. And so the role of a functional physician is to be able to identify what's best for you. And then go ahead and help you be able to do that.
So if somebody's interested in having you help them put their puzzle pieces back together, what should they do?
So, well, the first thing we usually tell them is to do a 15 minutes complimentary phone consult, which helps them understand, what their issue is, and what the process will be for them, so that we are all on the same page in terms of making sure that we have the right expectations. Because sometimes when people come, they think, oh, I'm going to get 3 supplements, I'm going to get better, and that's going to be the end of it. And that's not a functional approach. That's a Band-Aid approach. Functional approach is to actually go into the depths of finding out why is this happening, and then you address it accordingly. So that's the first thing, that I would recommend. And I think, Kat, if you have that link, you can send the link where, you can online kind of schedule your 15 minutes if you want to kind of figure out, how do we address that issue and how would we do it in your case.
So that concludes today's prepared questions. I'm going to go ahead and ask that if you have any questions that came up, go ahead and type them in the question answer section. I'm going to prepare to go ahead and pick from those. So next webinar will be the toolbox for the mind. The Art of Healing Stress, Anxiety, and Depression, which will be March 27th at 4 p.m. Registration is required to get the link so you can watch it live. Seats are limited. And we will be discussing the role of conditioning, context and trauma, brain-hormone interaction, brain-gut connection, inflammation, and oxidative stress. So if you've had any experiences or challenges pertaining to stress and anxiety, depression, go ahead and email us or DM us on Instagram or message us on Facebook. You can go ahead and share your story or your challenge. We'd be happy to have that. And all of our contact information is right there. So I'm going to go ahead and look at some of the questions. And if you have any questions for Beth, please feel free to ask those as well. So one of the first ones is this covered by insurance, or how much does functional cost? So I think maybe going over that briefly would be helpful as like kind of why, if it is or isn't.
So I think the best thing would be, in order for you to know what the cost information there is actually on the website, they're frequently asked questions. So you can go ahead, you can find out, what is the cost of the consultations. We definitely do not take any insurance, but the cost information will be available on the website in frequently asked questions.
What is the most effective way to reverse or manage Hashimoto's in a young adult?
I'm not sure what's the best way to manage Hashimoto's, but as we know, Hashimoto's is an autoimmune condition, and the question really, there are a lot of variables there. The first variable is, do you still have antibodies? Do you not have antibodies? Why did you actually develop Hashimoto's to start off with? Do you still have leaky gut? So those are the questions which have to be answered to be able to find the best way to kind of make sure that your immune system is still not activated.
So, I see this one says, is it okay to get the COVID vaccine if you have Hashimoto's? So I would like to kind of ask that is it okay to get the COVID vaccine if you've had an autoimmune disease or if you have one of those?
So again, it depends on your situation, because we know that Moderna and Pfizer are vaccines where there is a potential for an autoimmune response. Johnson & Johnson may not be the case. But I think the important question is whether your disease is controlled or is it not controlled, So that's the other question. What have you experienced with vaccines if you've had them before? That matters, right? So there are a number of things that you need to be able to know before you can kind of say, okay, whether I should have a vaccine, should I not have a vaccine, what type of vaccine should I have? So those are all the questions which have to be addressed before you can answer the question.
How can you help Sarcoidosis? SARCOI? Yes. Pain, fatigue, shortness of breath, and brain affects the whole endocrine system. So is there something that we can do, or something small even?
So sarcoidosis is a condition. So it's very interesting. So sarcoidosis is called a granulomatous disease. A granulomatous disease is a disease where you make granulomas. Those are small rounded structures that you find in organs where you have sarcoid issue. Sarcoid can affect almost any organ in the body. What happens in sarcoid is there is an immune activation again. So what happens, there was a foreign body that came inside the body. And the body started to kind of contain it. And that's why it formed the granuloma. But what happened is that, the body, the inflammation got out of hand. And so usually what's supposed to happen, and you're supposed to make a granuloma, and then you're supposed to get rid of the toxin, and then that's supposed to resolve on its own. In these individuals who have sarcoidosis, they are not able to resolve the inflammation that was created by the body because there is super duper immune activation. So again, sarcoidosis is considered a type of an auto-inflammatory disease because there is immune activation involved. So the process will be the same. The question is what has entered the body and caused the immune system to be super duper activated. So that really is going to be the same approach we'll have to take because it is an auto-inflammatory disease as well.
What is the connection of Candida with autoimmunity?
Like I said before, that a lot of bacterial and fungal infections are implicated, and Candida is a fungus that can reside in the gut and that can cause systemic inflammation. So just like any other bacteria, this is a fungus that can cause exactly the same thing. It can cause a lot of inflammation. It can cause activation of the immune system. And so it can cause autoimmune disease because it can also cause leaky gut.
What are biological treatments?
Biologics. Biologics, as I have explained, in one of my slides, they are big guns. They are the way they work is they completely oppress or suppress your immune system. When you do that, there are chances of a lot of side effects because we need our immune system to protect us from diseases, but it is also the immune system which has to be intact for us not to get into diseases like cancer. So if you are going to take biologics, you have to be aware that they have severe side effects like risk of severe life-threatening infections. They can also cause autoimmune diseases. They can cause neurological symptoms. They can cause sudden cardiac issues like sudden heart failure. So there are lots of implications of using biologics, which is simply suppressing your immune system. That does not change the course of the problem. It does not change the problem that's residing in the body. So if you say, well, there's nothing helping me, I had to start that, understood. But the question is, do you want to be on the rest of your life? Is that a good strategy? I'm not too sure about that.
Thank you. So is dementia, Alzheimer, an autoimmune disease? I know we did a whole webinar on it, so please check that out.
Yes, and I think that's what I would tell you. Please go ahead and check out the webinar so you will have all your answers about Alzheimer's, dementia. It's being discussed in a lot of detail.
And so what causes the immune system to attack the red blood cells resulting in autoimmune hemolytic anemia?
So remember, it is about protein. So antibodies are directed against protein. Our system recognizes bacteria and viruses on the basis of their protein. It's not like a virus comes inside and says, okay, I'm COVID, I'm here for attacking you guys. So the way that the system identifies a virus is the virus comes in and makes certain proteins, which the system identifies as non-self. It says, well, these are foreign proteins. They don't belong to us. We are going to go ahead and target this protein. Now, imagine if that protein, which is coming inside the body, part of that protein resembles a part on your red cell. So then the antibody, which was directed against a particular virus, will also be directed against the red cells. So that is the concept of molecular mimicry. And that is the reason why that happens. Now, instead of RBC or red blood cell, what if the virus resembles a part of the thyroid? Then the body will go against the thyroid. What if that part resembles part of your cartilage or ligament? Oh, then they'll go against that. And then you will have what is called rheumatoid arthritis. So it is about, whatever is entering, whatever protein is being made, what does that protein resemble inside the body?
So can a biologic cause yeast infections?
Of course. Any biologic, any steroid will cause infections because your immune system is completely suppressed. That's the whole idea of giving a biologic, to suppress the immune system, because we are saying that autoimmunity is a result of immune system being out of hand, being imbalanced and just killing cells. So of course, that's the whole idea of a biologic. That's the whole idea of a steroid.
Is IVIG treatment considered a biologic treatment?
IVIG is a different ballgame. It's not a biologic. IVIG has its own issues. IVIG has its own side effects. IVIG is also used in cases of autoimmune diseases where, you find that nothing is working and the disease is out of control, then you go with IVIG. But again, IVIG is not going to completely address the issue. The issue still remains because there is something going on which is activating the immune system. So you still have to address the issue at hand.
Okay, I'm going to go ahead and close questions and just finish the rest of them that are in there right now. So that's why I turned my camera on. So I have a few more. Do you find that gluten sensitivity is significant for most of your patients with Hashimoto's or even autoimmune?
So gluten sensitivity, we don't find a lot of gluten sensitivity in our office. We are finding non-gluten wheat sensitivity in our office. Do you have it? Is something that we will not be able to tell you until we do a test. So we are not going to just kind of label you as gluten sensitive simply because you have a particular autoimmune disease.
I have sarcoidosis. I am so tired and I'm supposed to be starting Humira, but I decided to wait till after I had the COVID shot. I get stuck for blood every 2 weeks while doing treatments that aren't working. My liver cannot handle bios. So a specialist told my rheumatoid to double my Humira dose, and I'm worried. Are there any ideas, any suggestions?
Again, like I said before, it's everybody. This is not a conventional medicine where one thing does not work, you start the second one. You really need to understand what's going on with you. Why is it that you're experiencing what you're experiencing? And then kind of go from there. I mean, clearly, if you're not able to tolerate biologics and you go up on your Humira, that's not necessarily going to be the best, way out of the situation. You really need to understand why did you get phagoliosis? What's actually causing the immune activation? That's how I would go about an autoimmune disease.
Do food sensitivities play a role in autoimmunity?
Food sensitivities play a role, but the way it works is that a lot of times food sensitivity comes after leaky gut. A lot of times. In some cases, if you are eating a lot of processed food, then they can be the cause of leaky gut. In a lot of times, what we find is first there was a leakage, and then the food went in undigested, and then you produce antibodies against it. So that is why there is a way we do our evaluation. We don't do all the tests at the same time because we understand that as a possibility, and we don't necessarily want to restrict everything. So you want to do them in a particular order.
Do all fat stores contribute equally to autoimmunity, or does one play more significant role than the other?
That's a really good question. Visceral obesity, fat in your belly is the culprit, not fat in your legs or arms. Fat in the belly is where the problem arises. That's why we have something called body composition analysis in our office, where we can actually tell you what is the degree of visceral obesity or fat in the belly.
What is most likely behind a flare? So if somebody gets a flare, maybe I don't know if everybody knows what a flare is either. So if you could kind of briefly say what is a flare and what could you do?
So a flare is simply an exacerbation of your symptoms of the disease. And what causes a flare is that something has happened. Something that you were either exposed to, a new factor has happened, which has increased whatever activity was going on inside. Like I told you, the girl would get a urinary tract infection, which was not a urinary tract infection, but she would have some symptoms. Then they would do a test, they would say positive culture, and then they would treat with antibiotics, and the mucus flare would come up. So you put in antibiotics, the leaky gut actually got worse. The bacteria, bad bacteria now became even more powerful, and now they are going to release more toxins, and now you have a mucus flare. So everybody will have a different reason for a flare. So you have to know why is there a flare up in this person versus another person who was not taking antibiotics.
Could you go over what oxidative stress was briefly?
Oxidative stress is simply what happens is that, when you have a lot of inflammation, you produce a lot of free radicals. We all produce free radicals, so it's not a big deal, but we also have antioxidants, which are able to get rid of the free radicals. But if the amount of inflammation is so high that all your antioxidants are used up. So now you have no antioxidants. And so these free radicals, which were supposed to be taken care of, are not being taken care of. So now they are going to actually damage the tissues and organs of the body. So now we are doing our own destruction because we are producing these free radicals and we do not have the capacity to get rid of them.
Is there a perspective of autoimmunity in the practices of TCM or Ayurvedic medicine?
So TCM and Ayurvedic medicine are tools, okay? And every tool, if you give me a scissor, it will cut. If you get me, we have that tool where you, what is it called? The one for the garlic squeeze, that's just for garlic. And so every tool is for a specific purpose. Ayurveda has its own strengths. Ayurveda is great if you're trying to treat a gut situation. Ayurveda is great if you're trying to treat a liver condition. Chinese medicine has its own strengths. So Chinese medicine is great when you're trying to treat lung issues. Chinese medicine is great when you're trying to treat kidney issues. So it's not about should I use Ayurveda or should I use Chinese medicine. It is about what is going to be the best fit for me. And when we are using herbs, we are using Ayurvedic herbs and we're using Chinese botanicals, because it depends on what is it that we are trying to address. So if I say, well, I know how to do acupuncture, I'll treat everything with acupuncture, that statement right off the bat is incorrect, right? Because, it is not possible for acupuncture to treat everything. Certain things it can do a good job, certain things it may not necessarily work. So every tool has its place. So you need, as a functional physician, my goal is to be able to figure out which tool will work best in this case in particular.
Can gold crowns make autoimmunity worse, or other metals in the mouth?
Metals. Mercury definitely we know has been linked with autoimmunity. Other metals have been linked with autoimmunity. Gold, yes, is a possibility. Again, it's interesting because gold was at one point in time used for treatment of diseases in olden times. I think it's too expensive right now to be used for treatment, but definitely it has the potential. So yes, any metal that you're going to use, you have to be very careful because it can be a source of problem.
Okay, there we go. Do you use colostrum as immune modulating supplement?
In some cases we do, but again, I think that this is where I think I would say functional medicine differs, is that before you can achieve any immune modulation, you need to be able to remove the actual problem. You cannot modulate immunity if you don't remove the problem. So if you're using, okay, I'm just going to use colostrum, I'm going to use X, Y, and Z, and I'm going to change and modulate my immunity. No, I know 100 things that I can use to modulate inflammation. But I know that those are still band-aids. I can use them, but I know they're not going to do the trick. I still will have to find out what's going on. And that's what you will have to do, find out what's going on. And colostrum is not for everybody, just so that we're on the same page.
How do radiation treatments affect the immune system?
So radiation systems are usually localized, and where you are going to do the radiation, that is where you are going to be seeing certain changes. I'm not too sure if we can say that they directly cause autoimmunity per se, but they have been more implicated in destruction of certain tissues. Like we know that when you are radiating the belly, those people will have what is called radiation colitis, where the colon will start having diarrhea and bloody stools and stuff like that because the colon cells are being destroyed by the radiation. Because radiation affects cells which are actively growing, right? And so radiation can affect certain cells in the body, and when you destroy those cells, that can cause inflammation. And can that play a role in autoimmunity? Yes, it's possible it can play a role in autoimmunity, but radiation directly may not necessarily be causing autoimmunity, but indirectly it has the potential.
Recently, I've been experiencing leg tingling at night, which seems to be permeating to my upper back and feet. Is there any hope for me at age 71? I'd like to be around as long as possible without burdening others to care.
So one of the things that I realized in my, my role as a functional physician is that the body is it's a very sophisticated organ, but it's also an organ with a lot of resilience. So age actually does not matter. The body has the ability to turn around. I have patients who are in the 70s doing amazing. And when they came to me first, I was thinking, oh, well, with this age, I don't know how long it's going to take, but I didn't want to kind of be hopeless about the situation because I knew it's going to help. I just don't know how quickly. And they turn around so quickly and they actually, surprised me. So I think that, yes, definitely, just because you're 71, if you're good 71, you've been doing good, you have a lot of hope, and the body is very resilient. So definitely you can work on it. As far as tingling is concerned, it's a neuropathic symptom. There are many, many, many causes of tingling. And we need to figure out what is in particular your issue. Clearly, we cannot diagnose it at this point in time, but that's something that can be looked into.
Have you worked with neurosarcoid?
Neurosarcoidosis. I have definitely worked with sarcoidosis, and we have had really good results with sarcoidosis. I had a man who was actually on methotrexate. And the only thing that methotrexate was doing was increasing his liver function test and ruining his liver. But his symptoms were not going away. He had many lesions, losing a lot of hair. And then we kind of were able to stop all his lesions that started shrinking. And so, yes, sarcoidosis is something we have worked with, and it's certainly something that can be helped.
Is Raynaud's syndrome an autoimmune disorder?
Raynaud's syndrome is not an autoimmune disorder, but it's a symptom which is actually linked with a lot of different autoimmune diseases. And so if you have, so it's very interesting, a lot of people will tell you they've had Raynaud's syndrome for a long time. They say, oh, it's been there forever. And that's like one of the signs. Like if your body is telling you like there's something not going in the right direction. If somebody has Raynaud's syndrome and no other autoimmune disease, I would be worried because I would think that they're probably on that line where you're developing the antibodies and I would take care of it because it's definitely a sign.
What is the connection between fake protein and leaky gut?
Fake protein?
Fake protein. So I'm not quite sure if that's from the powder or a fake meat.
Okay, I mean, I'm not sure if I understand the question because leaky gut is very different and a fake protein is very different.
Okay. I'm going to go ahead and move to the next one. Do you treat pancreatic cancer treatments with, do you treat pancreatic cancer with mets to liver?
So we have a integrative cancer program that I definitely want to look into, and we treat many different types of cancers, and clearly we're looking for a stage 4 pancreatic cancer. There are modalities which can be used for these patients to help them. Again, we have to be realistic about what we expect in this case scenario, and my suggestion would be to do the 15 minutes first so that you understand what the program entails and what we can do for you, so on and so forth.
So, with clarification, the protein that acts like an organ. So, the protein that acts like an organ for fake protein. I'm not sure.
Are you talking about glandulars? Is the person talking about glandulars?
Possibly.
I'm trying to see if I can find what. Is it fake proteins or is it whey protein?
Fake. Okay. So Dr. Ali, the sacroid lesion inside my spine, is inside my spine, so they cannot operate on it. They have shrunk, but they say it can inflame again. So is there anything for precaution for inflaming it that they could take? Is there a precaution they could take? It's kind of individual.
I think it's individualized. There's no way. I mean, this is, I think, another thing that we think that, we cannot treat everybody the same. So we have to be able to understand what's going on with them, to be able to tell them exactly what we want them to eat or not eat, or do or not do.
Well, that completes all of our questions up to that 5:11 mark. I did answer a few extra. So thank you all for who attended, and have a wonderful day. And thank you again, Elizabeth, for sharing your story.
Thank you, everybody.
Bye-bye.
Bye.